Well, I've spoke with some of our oncologists, and the collaborative process, the working process, and the transition between oral and also IV medicines, and the determining which is best for the patient, and how we actually communicate. We're seeing some things work in that regard. I think some of the biggest issues that are holding back is some of the issues with the pharmacy benefit managers, the PBM issue here, where you're having DIR fees that are costing more, that are pushing us further into a hole, especially with the donut hole with our Medicare Part D. And which at the end of the day is basically having the PBMs having their hand in everybody's pocket, because not only do they get it from the sale of the drug and from the rebates they're keeping, but then when they push us into the past that catastrophic care, CMS is having to pick that up, so they might as well just be taking it out of my pocket even if I'm not even getting the drug itself. So that's sort of the things we're looking at. I am. Part of House leadership, of course, I look overall House leadership and working our medical, but some of the things from the pharmacy perspective is MAC transparency. That's a bill that I have had now for several years. Just trying to get, breaks it down to 7 days updating on the generic price list. It really affects community pharmacists. The average community pharmacist lose about $83,000 a year just in DIR fees, but also in this generic pricing, where they're actually ending up selling medicines at a loss because they're not updated. So we do that. We also do provider care, enhancing provider care from pharmacists and how they can actually, help their communities. And then also the DIR fee issue with Morgan Griffith, a friend of mine from Virginia. We're working very hard on that.